Hello, my name is Amtul Carmichael. I'm a consultant oncoplastic breast cancer surgeon. I'm here to support you through your journey of breast cancer diagnosis and treatment. If you have been diagnosed with early breast cancer and been given options of breast conserving surgery or mastectomy by your team, how do you decide? This decision depends on many factors. What does the evidence say? What does feel right in your hearts of hearts? And how does your breast team support your decision? Let's work through these now. The evidence suggests that women treated with breast conserving surgery, which is lumpectomy and radiotherapy, or mastectomy, live just as long. So it does not matter what operation you have, you live just as long. The only difference is that the risk of cancer coming back is slightly high in women who have breast conserving surgery. This risk is not very high and can be easily treated with mastectomy at a later date. Then, what feels right in your hearts of hearts? Some women feel complete if they have both their breasts. They feel more comfortable if the breast could be saved. And in this situation, lumpectomy is the right option for you. While some women, if they develop cancer in their breast, find it difficult to live with the breast and wish to have mastectomy. If this is what you wish to have, that's a perfectly safe option and you can discuss that with your team. You need to discuss your decision with your breast care nurses and breast surgeon to get their advice and support about the appropriateness of this decision. Whatever decision you make would be right for you because you know your body better than anybody else. If you choose to have mastectomy, you are eligible to have immediate or delayed reconstruction. Immediate reconstruction means that you have breast reconstructed at the time of mastectomy, or you may choose to live with mastectomy for a short period of time and come back for reconstruction at a later date when you are ready to have this discussion. We will talk about it in the next video. Till then, take care, look after yourself, and be breast aware.